And thank you so much for joining us. Welcome to our fifth webinar of our 2021-2022 series. Today, our fantastic neuropsychologist, Dr. Danielle diFilipo, she's going to be educating us on all the different kinds of evaluations out there. You know, many parents haven't even heard of, an evaluation or what it is, or that you can get one until someone says, go get one. And then you start looking into it and you realize that there are just so many different terms. A lot of them are used very loosely and interchangeably, whether that's correct or incorrect. And even professionals can't necessarily agree on, well, what makes this evaluation this kind versus that kind. There's not a lot of hard and fast rules, but Danielle's going to help us wade through it all and try and understand it as best we can. So I am Mandi White-Ajmani. I am the owner of Small Brooklyn Psychology. We are a group psychology practice at Industry City in Brooklyn, New York, where we offer therapy and neuropsychological assessment for people of all ages, all backgrounds, and all psychological concerns. And so you can see our clinicians there at the bottom. That's me. I do neuropsychological testing. We have neuropsychologist Dr. Natasha Brown, therapist Jill DiPietro, therapist Sam Janit, therapist Deidre Edwards, neuropsychologist Nav Gill, therapist Ben Janitis, therapist Maddie Lawler, and neuropsychologist Danielle diFilipo, who is here with us today. We all have experience working with people across the lifespan, but we also have special training and experience to do assessment and treatment with children and parents, even down to babies and toddlers. So as I said, this is our fifth webinar in this year's monthly series. Now, recordings for all of our previous talks from last year and then also from earlier this year, they are on our website at www.smallbrooklyn.com/services/talks. And we cover a lot of ground in those webinars, from tips on managing behavior at home and in a classroom, to what a neuropsychological evaluation is and how it helps, to how to understand mental health issues in children and adults, how to explain diagnoses to kids and what that even means, and then also how to take care of yourselves as parents and as non-parents. We do plenty of work with adults and non-parents as well. All of that's available for free on our site. Our next webinar next month will be on March 9th, where therapist Jill DiPietro is going to talk about the ABCs of EBTs, which are evidence-based treatments, which, kind of like evaluations, have a vocabulary all their own. And people throw around all of these acronyms, and it can be really easy to lose track of what's what. So Jill is going to talk us through all of that. And registration for that talk is going to go up in a couple of days, maybe even tonight if I'm really diligent, so watch out for it. Our webinar series has been media sponsored by Park Slope Parents for the last 2 years, and they are phenomenal, and we're very, very grateful to them for their support. If you are a parent in Brooklyn and you are not on Park Slope Parents, I really recommend it. They have just so much information, so many resources, so many ways of connecting with the community, finding other people that can help you with so many different questions and experiences and support. And it's not just parenting related. There's so much that's there for careers, different cultural backgrounds, cooking, gardening, lots of different stuff. So please feel free to check them out. Now, during this talk, if you have questions, type them to me in the Q&A box. I'm going to monitor everything while Danielle talks, and then we're going to come back together at the end and we'll have a conversation about all those questions and other things that might come up. So I'm now going to introduce you to Dr. Danielle diFilipo. She joined us in September, and we are just so lucky to have her. She is a clinical neuropsychologist. She has experience conducting evaluations across the lifespan. She got her bachelor's degree at Barnard and her PhD in clinical psych with a forensic concentration at John Jay College of Criminal Justice, which is the graduate center at CUNY. Her pre-doctoral internship was in neuropsychology at Hamilton Health Sciences in Hamilton, Ontario. And her postdoc fellowship in pediatric neuropsych was at the Promise program at Columbia University, and that was before she came to us. She has evaluated people with neurodevelopmental differences, so things like ADHD, autism, learning difficulties, complex medical histories, traumatic brain injuries, movement disorders, degenerative diseases, epilepsy, cancer, all kinds of psychological symptoms like depression, anxiety, psychotic issues. Danielle has also worked closely with the school systems in New York City and has also helped me with some of that, because it's Byzantine. It's Byzantine out there, and she knows a lot about it. Even having been in it myself for a while, that there are new things I can learn from Danielle. So she has a deep understanding of how to provide that educational advocacy. She also is currently supervising some of our trainees and as well as in the past, and she has conducted research in neuropsychology. So I'm very excited to hear what she's going to say. I am going to mute myself and kill my video here, and Danielle is going to lead us through it. So thanks so much, Danielle.
Awesome, thank you. Yeah, so going to be talking to you today about the different kinds of evaluations that are out there. And just to kind of set the stage for who I'm going to be talking about today. And Mandi mentioned that, we see people across the lifespan. So who can get an evaluation? I mean, the short answer is anyone. You might need to find a specific person or agency depending on the age of the person who's being evaluated. So for example, if you're 0 to 3 years old, you're going to turn to early intervention or an outside or private evaluation. So when I say private or outside, I really just mean anyone who's not affiliated with the Department of Education or schools. So that could be private agencies, but also things like hospitals or other kinds of clinics. If you're 3 to 4 years old, you're looking at the Committee on Preschool Education or the CPSE or an outside or private evaluation. 5 to 21 is for the Committee on Special Education or an outside or private eval. And then if you're 21 and older, you're pretty restricted to those outside or private evaluations. Private evaluators will identify the age ranges that they work with. So some people work only with kids, some people work only with adults. Some people don't have as much experience with that like 0 to 3 age range or the older adult range. So it's worth, asking if you don't see it advertised somewhere. The left side over there in the blue is kind of your DOE or government organizations. And then obviously that right side is more of your private pay or, insurance-based options. So today in this talk, I'm going to be saying child or children a lot. And really, broadly, I'm talking about the 0 to 21 age range. But a lot of the information I'll be talking about is most relevant for like 5 to 18 years old. So your kindergarten through 12th grade age range. A lot of things do apply to the younger kids, but specifically some of it will be focused more on those 5 to 18-year-olds. So what kind of happens to get an evaluation? And Mandi touched on this too. It always starts the same way. Someone, a child or a student is struggling at school or at home, and someone notices. That could be a parent, a teacher, a school administrator, a doctor, really anyone who notices and wants to know why that child is struggling or wants to know how they can really help. So then we turn to an evaluation. You can request an evaluation through the DOE, the Department of Education, and or you can seek out those outside or private evaluations. You can do both. So sometimes you can sort of supplement whatever the DOE is testing for, or if you get an outside or private evaluation, that can be used almost instead of what the DOE would be testing. So you can still get school-based services, even if you do just the outside or private eval. So there's all different kinds of assessments. These are just a few of them, the ones I'm going to be focusing on today. Of course, there are other types of testing. So for example, you can do audiological testing to determine if there's hearing impairments, things like that. But today I'm going to be mostly focusing on the psychoeducational, the domain-specific assessments, psychological or psychiatric evaluations, and then of course neuropsychological evals. Any of these could be completed by a private evaluator. If you do request an evaluation through the DOE, they will give you the psychoeducational evaluation, and some of the domain-specific ones, and they are required to do those upon request, essentially. So how do you decide which one is going to be the best? I want you to kind of keep in mind as I'm talking what the goal is for testing. So this is something to think about as we kind of go through the different kinds of tests or evaluations. You want to think about what your end goal is. Are you trying to describe how your child is performing at school, or how they're feeling, how they're behaving? All evaluations are kind of address that. Do you want to figure out why your child is having some difficulties? And of course, do you want to figure out the best way to help your child? So as we kind of talk about the different types of evaluations, these are kind of the questions you want to keep in mind, and think about what that type of evaluation will tell you. So now we'll get a little bit more into the different types of evaluations, and we'll start with the psychoeducational, which you might also hear me call a psychoed. So that is, if you complete it through the Department of Education, it will usually be completed at school. If your child is in a private school, it might not be in school, it might be at a different office, but that's a little bit variable. And then the testing itself will last maybe a couple of hours at most. And I say testing itself because there are other components to an evaluation. So you'll, as a parent, you'll be answering a lot of questions about your child's history. And so that's kind of separate from the actual testing part. But those are usually pretty brief too when we're talking about a psychoed. Psychoeducational evals are pretty simple or straightforward. They're going to give an IQ test and they're going to give an academic test, at least the first time you get a psychoed. If you're getting a reevaluation, you may or may not get that IQ test again, but you'll at least get the academic testing. There are many different kinds of IQ tests. Most of them will look at verbal and nonverbal reasoning and problem solving. Some of them might also assess a couple of other cognitive skills like your processing speed or your working memory, but it's not in great depth. There's also many different kinds of academic tests, and most though will be looking at your basic reading, writing, and math skills. So what will an IQ test tell you? An IQ or intellectual capacity is really just an estimate of your aptitude or your capabilities. So we want to know, can we expect your child to understand new concepts, use logic and reasoning, and solve new problems similar to the ways that their peers do? And do they have a particular weakness in verbal or nonverbal? That could kind of help figure out if they need different kinds of instruction. Again, not in any great depth. Academically, really, you're just trying to figure out if your child's performing at grade level in some of these basic skills. So reading, writing, and math. And then again, does your child have a strength or weakness in one of these areas? The strengths, if you're getting a psychoed through the DOE, they're not as focused on strengths. They're usually just looking to see if your child is at grade level, and if they're not, then they, might give some interventions. But if they are, or if they're advanced, then they don't really pay as much attention to that. So thinking back, what are we trying to find out? Of course, a psychoed will describe how your child is performing in those particular areas that it's measuring. You do want to keep in mind that the testing environment is not always the same as a classroom environment. So that can kind of factor in. Sometimes you can figure out why your child is performing poorly. It often depends on who is doing the assessment. So the DOE doesn't really go as much in depth. They cannot diagnose any difficulties. They can describe them, and they can provide a classification for your IEP if you get one, but they can't diagnose. So they can't go into as much depth. If you get a private psychoed, they may have a little bit more insight into why there are some issues. And determining the best ways to help your child, I put a little asterisk here. If you get a psychoed through the DOE, the report itself will almost never list any specific recommendations. They will leave that up for discussion at the IEP meeting. They will eventually make those recommendations, but private evaluations will have recommendations in the report. And here we're looking at school-based services. So that's what a psychoed will get you. They might be able to tell you the type of classroom that your child should be in, if there are any academic interventions that they would suggest, if they need any classroom or testing accommodations. They can recommend certain related services like counseling. And then, that's pretty much it. So that's the psychoeducational evaluation. So now we'll talk more about the domain specific ones, which are also done by the DOE or privately. Again, the DOE will usually complete it at school. And the testing is pretty brief, usually no more than an hour per domain. Again, the DOE can and should conduct these evaluations. And these are the kinds of evaluations I'm talking about when I say domain specific. So we're thinking about what's also called related services, things like speech and language therapy, occupational therapy, physical therapy. Those are your some of your related services that you can get at school or outside of school. If you want these evaluations, you may have to specifically request them from the DOE. The DOE is supposed to evaluate any area of suspected disability or difficulty, but they don't always. So sometimes you just have to request it specifically. Another thing to kind of keep in mind is that a lot of these issues that I'm going to kind of go through can be addressed or looked into with a neuropsychological evaluation. But a lot of neuropsychologists, in fact, probably most, if not all, can't specifically do these types of evaluations. The training is different, the measures and tools that they use are different. So even if you get something like language addressed through a neuropsych, you might still need a referral to a speech and language pathologist to go a little bit more in depth or make determinations about services and things like that. I'm not going to spend a whole lot of time on each of the next few slides, but I just think it's important to kind of be aware that these type of evaluations exist and they are available, and you might get a referral for one. So with the speech and language evaluation, we're thinking about, does your child have any speech problems that could interfere with your ability to understand what they're saying? Do they have trouble getting their thoughts into words in general? Do they seem confused a lot? Do they respond to questions with off-topic answers? Do they have trouble understanding things like sarcasm or idioms? These are all different areas that a speech and language eval will get at. As I mentioned, a neuropsych will also address a lot of these issues or evaluate for them. But again, the depth of it is a little bit different. And especially if you're trying to get services at school, the DOE will still want to at least review your findings, maybe do a little bit more testing of their own, and then make that determination by a speech language pathologist. It's the same thing with occupational therapy. So here, OTs will work with fine motor skills. So if your child has messy or illegible handwriting, or if they have trouble with things like tying shoes or fastening buttons, those can be addressed with OT. OTs also deal a lot with like sensory integration and like self-regulation. So if your child seems really inattentive or behaviorally dysregulated, sometimes an OT can address those issues with therapy. And similarly, if they're seeking out or avoiding certain sensory inputs. So if they really hate or really love really tight hugs or loud sounds or things like that. Okay, and with PT, we're thinking about your gross motor skills, so your big muscle groups like your legs and your arms. So if your child has trouble with balance and coordination, or if they have trouble walking, running, using stairs, navigating the environment, really, that's when we're going to start thinking about physical therapy. Assistive technology evaluations are out there. That's to determine if your child needs some sort of tech in the classroom in order to succeed. Especially as children get a little older, sometimes their writing is so slow or laborious or messy that it really impacts their ability to kind of show what they know. And so they might get assistive tech for that. Kids with visual impairments, if they need something like an e-reader or like something that they can enlarge the text or the font size or have audiobooks. And if they need a device to help them communicate, so children who are nonverbal or minimally verbal, that might be useful for them. Again, some of these issues can be addressed by neuropsych, and neuropsychs you'll sometimes see we'll make these recommendations, but it's kind of a case by case if the DOE will want to do their own testing. And then a functional behavior assessment is a pretty specific type of evaluation that addresses really problematic behaviors in the classroom or at school. So things like really disruptive behavior, aggression, eloping, so trying to escape the classroom or the school building where there's like safety concerns. If they're trying to hurt themselves at school, those are kinds of things that an FBA will try to identify. And the particular advantage here of having an FBA is that the evaluator is supposed to gather a lot of really detailed and frequent data from the classroom. So from the teachers, from themselves, and that's a little different from what a neuropsych will do. So they're going into much greater depth with the types of behaviors that you're seeing. So going back to our questions of what will this tell us? Again, they will describe how your child is performing in the moment. A lot of times, these domain-specific assessments will tell you why the child is performing poorly or having trouble, as long as the reason is within the scope of the evaluation that you get. So a speech and language evaluation will not tell you much of anything about attention. A PT evaluation will not tell you much of anything about behavior in the classroom. So, it's kind of like, what are you trying to figure out? And then determining the best ways to help your child. They can usually do this, again, as long as the intervention or thing that they're recommending is within the scope of the evaluation that they did. So for example, if you get a speech and language eval, they're going to recommend or not recommend speech and language therapy. Same thing with OT and PT. After the evaluation, they'll kind of tell you, or at the IEP meeting, they'll tell you what they think would be helpful. Again, assistive tech, if they think you need it, you'll get it. If you get an FBA and then they determine the interventions are the best ways to behaviorally support your child in the classroom, you'll get what's called a behavior intervention plan, or a BIP. So those two things often go hand in hand, the FBA and BIP. Sometimes you'll get counseling as a related service. And then again, if you get an FBA BIP, you may or may not get access to a paraprofessional in the classroom. And just to point out again that the DOE cannot diagnose anything. So even if a provider might have an idea of what a diagnosis would be, they can't diagnose it. So into the psychological and psychiatric evaluations, these are kind of exactly what they sound like. We're looking purely at the psych part. So your mood, your emotions, how it's affecting the rest of your life, your behavior, relationships, so friends and friendships, parent-child relationships, things like that, personality. They do a lot of this through interviews, sometimes questionnaires, and mostly that's it. Sometimes you'll get a test or two, but that's pretty rare. Often you're going to get this kind of evaluation if you're already seeking out therapy, like psychotherapy or psychiatric medication. So you're trying to initiate a treatment and they're going to kind of evaluate as part of their planning how they're going to help address any issues you're seeing. The duration can really vary. That initial eval might be about an hour, maybe a little more. It really depends on how extensive the interviews are and how much, background information they want to gather from other people. So that's variable. The DOE cannot and will not conduct psychiatric assessments. So what will these ones tell you? Mental health issues. So if your child is struggling with depression or anxiety, psychosis, mania, trauma, any other kind of mental health condition, these types of evaluations will try to identify that. Sometimes at the beginning, a diagnosis might be fairly vague, might be something unspecified. Depends on the goal for treatment, and sometimes the diagnosis will become more specific over time as the clinician gathers more data. They'll also look at your social and emotional functioning more broadly. So if your child has trouble with self-regulation, interpersonal skills, behaviors, things like that. And then how do all of these pieces kind of come together and affect other parts of life? So, if you have anxiety, for example, that can make it hard to focus in class. And, it can affect your friendships, things like that. Again, they will describe how your child is feeling and behaving. I put a little asterisk there because often we can't uncover a lot of depth all at once. So you'll kind of continue to explore and discover patterns over the course of treatment. They can often figure out why your child is feeling or behaving a particular way, as long as it's within the scope of psychology or psychiatry. And they will try to figure out the best way to help your child. Often that's going to be therapy. They should include the modality, so the type of therapy that would be most useful. And I believe that next month, Jill will talk more about those types of treatment options. They can recommend medication, although just to point out that only medical doctors, nurse practitioners, and physician assistants can prescribe. So not all therapists have these licenses, but they might, still recommend or refer you to a psychiatrist. And they can certainly make recommendations for school. And, they'll just kind of be taken into consideration if you're having an IEP meeting or a 504 meeting or something like that. Now, for my favorite, the neuropsychological evaluations. So what is neuropsychology? It's a big fancy word. Really, it's a subspecialty of psychology. So you have specific expertise in brains and the relationships between your brain, how it's developed, and how that creates or interacts with your behavior, your cognition, so your thoughts, and your emotions. And we use all that knowledge to, assess, diagnose, treat, rehabilitate all different kinds of issues. Pediatric neuropsychologists have a developmental focus, so it's even a little bit more specific. Obviously, I'm still talking about child evaluations, but adults can get neuropsychs and find them helpful for all kinds of different reasons. So in neuropsychology, we're not just trying to describe what is happening, but we want to figure out the why. We want to determine that because it really changes how you intervene or how you help support the child. We try to put all the pieces together and look at a person as a whole. So we're looking not just at a little sliver, we're looking at the whole thing. These are conducted by clinical psychologists, so people with PhDs or PsyDs. We have specialty training, and that kind of allows us to be more comprehensive. And because the assessments are so much more comprehensive, they usually the testing itself occurs over multiple days. Sometimes, depending on age, you can get through it all in one day, but most often we're talking about sessions from 2 to 6 hours, and you might have maybe 2 sessions. That all kind of depends on the referral question, your child's age, how fast they can kind of get through testing and their stamina for it. Again, the DOE cannot and will not conduct neuropsych evaluations. Sometimes they will grant vouchers for them, but there's a cap on how much they will pay. And from what I understand, those vouchers are pretty hard to come by. A neuropsychologist is looking at lots of different areas. We want to, again, be taking into consideration all of the different things that could be going on. You'll notice that IQ and academics are the same thing as a psychoed. So we kind of cover that area. Similarly, we will look at language, maybe not necessarily in as much depth as a speech language pathologist, but we are still going to look at it. Sometimes we will screen or kind of just observe motor issues. We especially spend more time on the fine motor because that can affect things like handwriting. But we will, notice any gross motor weaknesses as well. And those are usually covered by OT and PT. And then the social, emotional, and behavioral functioning, often covered by a psychiatric evaluation, also covered by a neuropsychological evaluation. The difference is, we go further. We explore lots of other domains. So we look at visual perceptual issues. We look at attention. If your child is inattentive, really distractible, we'll take a look at that. We look at executive functioning. So that's all of your higher order thinking skills, things like planning, organizing, working memory, which is kind of like holding information in your head and working with it, your processing speed, your self-regulation, your impulse control, just a ton of executive functioning. We look at memory and learning. And we also will look at adaptive functioning in addition to all those other areas. So again, you're getting all these evaluations kind of wrapped up into one so that we can really understand what exactly is going on. What can it actually tell you? We're going to look at your behavior or your child's behavior. So figure out, why does your child behave certain ways? How does your child interact with other kids, with other adults? How do they process information? So how are they thinking and learning and growing? We want to figure that out. And then emotionally, how does your child experience and communicate their emotions? Do they have any mental health or difficulties with emotional regulation or processing, and does that, interact with or affect other parts of your life? And really, the highlight here is that a neuropsychologist will look at weaknesses, but also really likes to focus on strengths too. So again, when we're trying to think about the whole person, we want to know what are some of the areas, the things that you're good at, and how can we use those. So you're going to walk away knowing how your child is thinking, feeling, behaving, why they're thinking, feeling, or behaving that way, and what can you do about it. Again, a neuropsychologist really wants to try to create a roadmap for you to figure out how to best support your child. We try to disentangle all the complex relationships between behavior and thoughts and emotions, and try to figure out the why. For recommendations, you will get many of them. They should be tailored to your child. So similar to a psychoed, we'll be talking about, classroom accommodations, school accommodations. With academic interventions, a neuropsychologist might have a better sense of possibilities that exist outside of school. So specific intervention programs that might be useful. We can recommend certain related services directly. If we can't recommend a related service, but we think your child needs it, then we will recommend an evaluation in that area so that they can get those services. We'll refer for therapy or medication, if needed, other kinds of follow-up evaluations, and really like the strategies for how to help at home or at school or with other providers in the community. How do you decide what type? Thinking about those questions again. We've kind of gone through them, and the DOE will probably not be able to answer all of these questions, but there are different options out there. I'm not going to spend too much time on these slides. They're just kind of here as a resource, but it's like more directly comparing like the different stages of an evaluation and the 4 different kinds of evaluations I talked about. So your psychosocial, it's kind of like an interview, just gathering background information. Cognitive testing, obviously not every issue needs cognitive testing, but it can be helpful when we're trying to figure out what's going on, because how a child thinks and learns is a big part of how they interact with the world. Social emotional functioning often is a big piece that often gets overlooked, especially with DOE testing. They might screen for some of those difficulties during an interview or with the questionnaire, but they're not necessarily well equipped to answer questions or provide guidance in those areas. And FBA specifically is looking at social and emotional functioning at times. This is kind of what your end goal or your end product will be. So what are you actually going to kind of walk away with knowing? Whether that's learning differences, emotional behavioral concerns, things like that. And then post-evaluation, what kind of recommendations are you going to get? How are you going to move forward? So when is a neuropsych your best option? Or when do you want to consider a neuropsych evaluation? If your child is having trouble at school, with friends, or at home, especially if you're already doing something, like if you have interventions in place, even if they're just like kind of behavior modifications or things that are less formal, If your issues are persisting despite those interventions, a neuropsychologist can kind of help figure out if there's a better treatment plan or strategy, or if there's something else going on that isn't really targeted. If there seems to be more than one thing going on with your child, or they seem kind of unpredictable, we can try to disentangle those complex or confusing presentations, again, to try to figure out what's going on. If you want to optimize your child's everyday functioning, but you're not sure how. So again, when we identify those strengths and weaknesses, we can help develop a plan for how to use those strengths and support those weaknesses. If your child has a complex medical history, so if they were born prematurely, if they had a head injury, if they have a genetic disorder, like anything like that, neuropsychologists are kind of uniquely poised, and specifically pediatric neuropsychologists are unique in their ability to understand neurodevelopment and how the brain like organizes itself, and how like medical issues can kind of affect that. And if your child had an evaluation in the past and you want or need an update, we can track progress, determine if changes are needed. If you get an evaluation through the DOE and your child is granted an IEP, the DOE is required to reevaluate them every 3 years, but that might not include certain things. So they might not do the IQ test again. They might just do the academic testing. And similarly, if you're getting a reevaluation outside, like from a neuropsychologist or someone else, it doesn't always have to be a full comprehensive reevaluation. It can be more targeted, depending on, again, what your goals are. So those are the different kinds of evaluations. If you are interested in learning more about how we can support you, you can contact us. And I'm happy to answer any questions.
Thanks, Danielle. This is a lot of really good information. Thank you very much. We do have some time for questions now. And so I see some people have asked some things already. So if you have more questions, please feel free to chat them to me, or actually rather in the Q&A box would be better. One of the questions that came up pretty frequently was, okay, what is an evaluation doing for us? And what are the things that we can get out of it at the end? And I think you did a pretty good job of covering it, but kind of just to summarize for people, like, what is the point of, say, a neuropsych evaluation? What are they going to walk away with?
Yeah, and I think, again, it really depends on what your question is. So, of course, if you get a neuropsych evaluation, or a psychological evaluation, you might get a diagnosis that can help kind of explain some of what's going on or all of what's going on. But really, it's the recommendations that you're looking for. So if I go back to this slide, the psychoed is going to get you set up with services at school, very specific ones. Those related services will get set up after a domain-specific eval. It kind of helps guide where you're going and what to do next. And a neuropsych is the most comprehensive way. It's kind of looking at all the different areas.
Mm-hmm. And in my mind, I think one of the most important things that comes out of a neuropsych eval is not only the document that has everything written down for you, but also a patient explanation of what all that means and what it means specifically for your child and your family in your particular situation. And so sometimes people will come to me and they'll say, well, I got this document. I don't know what any of this stuff means. And I don't know what
For
to do
sure.
about it. So, I think anytime you as the parent are getting an evaluation, please make sure that you ask a lot of those questions to your providers so that you are really walking away with a full understanding of what it means and how it's actually playing out for your particular child. And then some guidance on how to prioritize some of the things that Danielle has listed out in her slides here. I think that that's really key in order to make sure that this is not just an academic exercise, but is actually something that we can implement in real life, right?
Yeah.
So, clearly that's on a lot of people's minds as they're contemplating going through these evaluations, like, well, what is the point? And then another question that came up a bunch is, so you did a fantastic job talking about all the different evaluations and when you might get one for one or one for the other. What about when you have particular questions like, does my child have a reading disorder, for example? And you want to understand why, which I think is the real depth and strength of the neuropsych evaluation. But is it really necessary to go through that extra hassle? Like, what would you be getting, say, out of a neuropsych versus a psychoed for something like a reading disorder?
Yeah, it's a good question. Like, if you are specifically concerned about something academic, like reading, so we'll take that as an example. A psychoed will kind of see what level roughly is your child reading at, and then they will or won't give them some interventions at school, which may or may not be tailored or individualized. And it has the potential to miss a lot of things. So if you're concerned that your child has trouble reading, it could be something like dyslexia, which is a reading disability, or it could be something like attention. And if they're sitting down one-on-one with somebody and focused, they can read okay or at grade level. But it's when you hand them a chapter book and tell them to read one chapter by tomorrow morning, and they're off kind of doing something else, that won't necessarily get picked up with a psychoed. And then you might be putting your child into or giving them services that aren't necessarily going to help, because if they have an attention problem and not a reading disorder, you want to intervene in different ways.
Yeah, that's a really, really good point. And I see that when we're talking about ADHD a lot too, because there are people out there who will advocate for, ADHD is just a collection of behaviors. And as soon as you see the behaviors, then you can diagnose ADHD. But if you give somebody just a checklist and say, well, he has trouble paying attention to the book that he's reading, he gets distracted, he loses his book, you might be able to say, yeah, he's got ADHD. But actually, if you take that bigger step back, like you were just saying, and you see that maybe it's more of a dyslexia and you're not really looking deeply into that, or maybe it's anxiety that's getting in the way of him being able to focus and concentrate. There are so many different things that it can be. So I know we're biased, right? But I do think that neuropsych eval really gives that chance to look at just the entire system of a kid and understand the whole picture and how all the different parts are playing together, and also what is driving what.
Yeah.
So yeah, I get that question a lot. Do I really need a whole evaluation?
Right. Yeah.
Depends on the question you're trying to answer, but to really understand it. So we talked a little about IEPs, and someone did ask, by the way, what is an IEP? And there's just so many different acronyms that we throw around, right? Just go ahead. What's an IEP, Danielle?
Yeah. So an IEP, and I apologize for not, I should put a little glossary in here.
We could have a whole other talk on all of
I
that.
could give an entire talk on an IEP, but yes, it stands for Individualized Education Program. It's a legal document. They are given to children who have some area of disability, where they need certain interventions at school to help them succeed, or meet standards, essentially. So you'll need an IEP if you want something like speech language therapy at school. You can obviously get speech language therapy outside of school, but an IEP will it legally mandates those things.
And you get together with different representatives from different parts of the Department of Education to come together to decide what's going to go into that IEP. And so one of the questions was, can we make recommendations for specific language to put into the IEP? And so the short answer is yes, certainly. We absolutely make recommendations for things that we think would go into like the services that are provided, and can also make recommendations for the language, but it's just always up to the committee itself to be able to make that final determination of what's actually going in. We can be there to describe what we found, to support you, to advocate for the child, but in the end, it always needs to come down to the DOE. I mean, in practice, and you tell me if this is your experience too, Danielle, in practice, I feel like it's a lot less adversarial than people tend to imagine. And they do put a lot of weight and emphasis into the private evals that we send in, which has been great, but sometimes I disagree. But has that been your experience too?
Yeah, absolutely. I think schools on the whole really want to help your child, succeed and do well, and they want to put those supports in place. Sometimes there are, compromises that you have to make. Or, the DOE does kind of strictly adhere to there's like a continuum of services. So the least restrictive to the most restrictive. They're not necessarily going to put your kid directly into a classroom with only 6 other kids, for example. They'll start with something less intensive.
Right. Trying to find that balance.
Yeah.
So another question that came up quite a lot was once we've had an evaluation, how often do we really need to do it again? What do you think?
It's a great question. And I think it depends on each particular case, each particular kid.
I know,
which
such an unsatisfying answer, right?
Not the answer anyone wants to hear.
It depends. Yes.
For the most part, right, if you get, like, let's say an IQ test, if you get a psychoed, you don't want to repeat that test within like a year-ish. You can do like the academic testing a little more frequently. So in the past, like I've, tried to, on some occasions, like monitor progress after we put an IEP in place. So I might test, the kids reading again, just to see, like, are they catching up? So those can sometimes occur a little more frequently. Again, if you have an IEP, or if you get an IEP, the DOE is required to reevaluate you every 3 years. And there are other kind of like milestones where they will evaluate you sooner. So if you're coming from preschool into kindergarten, that's a whole process. And if you're using outside or private evaluations, like a neuropsych, I usually like say no sooner than 1 year. If you notice changes, if you notice that things aren't working, if there's a big transition, so kids are going into high school, into middle school, into college.
Yeah, is a big one.
Yeah, so those big transition points can be really helpful.
Really anywhere that somebody might need a new place or a new school might need to now figure out how they can provide the services that's going to support a particular kid. That is usually, like you said, a good transition point to figure out, okay, what's going on now? And what do they really need now? And then how can we actually provide those services? Yeah. And then, so someone asked how to even get an evaluation. So, you know, Danielle talked about the DOE. You contact the whoever is coordinating the special needs at your school. So sometimes it's assistant principal, sometimes it's a parent coordinator, sometimes there's a particular social worker that is in charge of it. So you contact that person, and you usually need to, in writing, request a DOE evaluation and to initiate the IEP process. If you want to get a private evaluation, you can contact any provider yourself. You can talk to a private OT, for example, and get an occupational therapy evaluation, or a speech provider, or a neuropsychologist like us. And so you know, we have our information there. Our email address is hello@smallbrooklyn.com. You can certainly reach out and talk to us about an evaluation. Thank you, very helpful. Yeah. So we are happy to do the evaluation, but we are also connected to lots of different providers in Brooklyn and Manhattan in particular, and can make suggestions for other people if we are not the best place to do that service for you. So we are always happy to help. And one more question. Oh, someone was asking, do you think it's necessary for, if you're getting an evaluation, I think particularly this person is asking about for a neuropsych, do you think it is necessary for a person to go to somebody that really specializes in a particular age group? So if you want someone who specializes in adolescence, do you need to go to a group that specializes in adolescence?
I think that the time, like the point at which you really want someone who specializes in that age range or has a lot of experience in that age range, is the 3 and under set, maybe even the 4 and under set, because babies and toddlers are going through so many changes and so much fast development. You know, there's a particular set of tests to use. There's, you know, a lot of specific knowledge.
You have to be willing to crawl under tables.
Yes,
and
you're going to be on
around.
The floor.
Yeah.
Exactly. Yeah.
We can do those, by the way, just in case anybody was wondering, where we have that specialty.
We do, yeah. Once a kid is kind of like 5 to 18 or 21-ish, most, you know, pediatric neuropsychologists will be able to handle that whole age range. So whether they're a teenager or a tween or, you know, elementary school, yeah, those should be fine.
Yeah. And then, but the reverse is not necessarily true. So if you have somebody who is an adult specialist, a lot of them are really focused on adults, as if there's like this very permanent line between like 18 and 19. Like, you know, we only see people over 18, but people who just don't feel comfortable working with kids in any way. So it is better to go to a pediatric person when you have that opportunity. Yeah. All right, well, we're running out of time already. And thank you so much, Danielle. We really appreciate all the information that you passed on. Thanks to all of you for joining us today. Definitely please come back next month on March 9th, when our therapist, Jill DePietro, is going to now take that next step, right? It's like, what are the interventions, especially for kids? She's calling it the ABCs of EBTs, which is evidence-based treatments. How do we distinguish between all the different types of treatment approaches for kids? Please reach out to us at Small Brooklyn Psychology for more help as you need to. And thanks as always to Park Slope parents for helping us to get the word out about our series. Have a great day, everybody.
Thank you.